My first experience with sexual anything was in the movie Look Who's Talking in the beginning, where the sperms are going towards the egg to the Beach Boys. And we left after 10 minutes. My parents couldn't handle that.
So I have an older sister. She's 3 years older, and she got her period before I did. And I know this because I walked in on my mom teaching her how to put a tampon in by showing her on her own body.
They didn't teach us about masturbation in school, and I remember the first time I masturbated, I thought I invented something.
And I remember my high school teacher had red hair, bright red hair. Well, her face was just as red as her hair, telling us what...
Yeah, that teachers are not comfortable teaching the subject matter.
I'm Edna Ackrey.
And I'm Margaret Marshall. And with lots of help from other people, we founded the Teen Pregnancy Coalition that now has become Health Connected.
I started this program called Outreach Specialists, and it was a program to provide services for kids to prevent them from dropping out of school. Through the counselor, through teachers, if a child had an issue, they would send them to me. And I was floored that this 12-year-old was pregnant. I needed support. This girl needed to know what was going to happen to the changes in her body. So I started calling the community and found out there wasn't anything.
Edna came to the school board and said, we have this problem. And we said, oh, well, we can probably fix that. But we went to the high school board to ask if we could have an agreement to do that. And they said, we don't want to deal with that. So then we were really at odds about what to do. And so we started meeting school nurses, counselors, outreach specialists. But then slowly but surely, people recognized that we were going to continue. We were persistent. Then that took 10 years to get it from the idea that we thought, oh, let's just have childcare.
So our mission statement, in its simplicity, is to help young people feel confident and supported to make informed decisions about their own sexual health. And that says it all. Trusting young people to make decisions for themselves that are going to be best for themselves, and also giving them the responsibility to make those decisions as well. And that may feel very uncomfortable for us as adults in a community, but it's really critical that we say, we trust you to do this.
Sex ed was like the one part of the school year where I was like raising my hand, like having a good time. I was like on top of it, and I was actually having a good time, and I actually looked forward to going to school. Just my mom, like being a teen mom, I grew up like seeing that side of it. Someone in my family had been living with HIV for a long time, so even at a young age, I knew about that stuff, and it was a conversation that was always relevant to me in my life. I feel really lucky that this has always just been my dream and something that I always wanted to do. And so I just feel passionate about it. I feel lucky stopping every day and being like, I wouldn't want to be anywhere else. I can't picture me doing anything else every day that I wouldn't get bored of.
Health Connected is an organization that takes information out to the kids, whether it's sex education or even broader relationship building, things like that. And it starts with the little guys. And I've heard teachers would like a program that goes down to even the teeny tiny guys, and then moves through junior high school and high school with the children. And as the kids mature, the program matures with them. One thing that it did for my kids, and they all, after they got to school, called me and said,
I didn't realize how good the health courses I took with Health Connected were until I actually got to college and realized how much other people didn't know. I think that I felt empowered because I had actual facts to work off of and information rather than having to try and figure out what was true through rumor by myself. It was very helpful and almost like a really good, engaging experience.
So I know that the program is receiving requests for their curriculum from Texas because there's just nothing else out there like it. And then you've created this avenue for discussion with them that they can have, and this openness that they can have for the rest of their life with you. And you know that when they go off to college, they're going to be knowledgeable and they're going to be safe. So it makes you feel good as a parent.
You know, I'm a parent, so I understand the challenges that many parents face in trying to help their children or the kids that they care for to navigate, you know, a very complex world. And we all want our kids to end up healthy, however we define that. However that happens for you, I want to support you to make that happen.
How do we take all of the amazing work that you guys have done? How do we take that and transplant it to other communities that can really learn from all of the community building we've done here? Yeah.
They have to ask for it first.
Yeah.
And they have to have a community that recognizes they need it in their community, because this was really, truly a community effort. And as I look at these old attendance lists, these were people who came, nurses and counselors and school people and administrators and community members who recognized that it needed to happen.
California had just passed the California Healthy Youth Act, which mandates comprehensive sex education in middle school and high school. It was going to be the first time that we had to teach sex ed in schools. We needed to find something that was going to be comprehensive and applicable for all the schools that we have, because we have such a variety of schools. We'll look through all types of curriculum, and I found Health Connected, and I was absolutely blown away. Health Connected had it all. They approach it from a community-based approach. They recognize that they need parents, they need teachers, they need community members, they even need the media to be a part of this comprehensive sex education that our students are receiving.
I would say like what makes us special is how inclusive we are, to try and run it in a way where no one feels like pushed away for how they think or how they feel or who they are.
From the very start, this is one of the first communities really that was dedicated to this in this way and dedicated to finding a solution for an adolescent health problem. We have an opportunity now to take this amazing work that has taken place over 30 years and be able to spread that to other communities now.